Hello and welcome to this episode of the Global Health Charity Show on UK Health Radio. Last Tuesday marked World Malaria Day, an event that highlights the ongoing impact malaria has on the health of millions of people worldwide and is responsible for the deaths of over 600,000 people, mostly young children, every year. In this episode, led by Malaria Consortium, we hear from global malaria experts spanning the public, private and philanthropic sector as they discuss what is needed for the world to eliminate this disease.
You're very welcome to today's session, where Malaria Consortium, with its partners, has convened a group of panelists that will be discussing a variety of topics around the rollback malaria themes for World Malaria Day of Invest, Innovate and Implement. I am James Benderana, the Chief Executive with the Malaria Consortium, a UK-based charity that is involved in malaria elimination as well as universal health coverage.
My name is Julian Amenofekafui. I work with Youth Advocates Ghana as a policy and advocacy officer, and I'm also a woman deliver young leader and also part of the SDG, the African Youth SDG Summit Secretariat, where it's basically me working in together, helping with the whole mobilization process of the summit.
My name is Papa Salif Sow. I am an infectious disease physician, professor of medicine from the University of Dakar here in Senegal. I have joined the Mastercard Foundation as director of the Department of Health very recently, and I'm based here in Dakar, Senegal.
Okay, hello and welcome. My name is Chukwu Okoronkwa. I'm the director of surveillance research and evaluation in the malaria elimination program in Nigeria. And I'm here based in Abuja.
Hi, I'm Luke Freeman, the Executive Director of Giving What We Can, which is a community of effective givers who seek to find high-impact interventions. We are a funding partner of Malaria Consortium's SMC program, which we find to be one of the highest impact opportunities for donors to fund to improve lives of people around today.
So, as you all know, malaria elimination is an ambitious target and one that we are all committed to achieving. And on that pathway towards achieving malaria elimination, investments are important, innovation is necessary, and is something that requires us to constantly keep a good handle on what innovations one should be bringing on board, but also the fact that we can't then get rid of the things that we don't find innovative, even though they're working. So we've got to constantly keep that insight as to what's working and what's new, and bringing on board new things because they're necessary. And then the fact that we must continue implementing at scale, as you've seen with some of the works around seasonal malaria chemoprevention, but also insecticide-treated nets. And something we all talk about over and over again is that how do we really place ownership and leadership in the hands of those who live within the countries that have the highest risk of malaria. So these are some of the topics that we're going to explore with each other, and I hope you'll all have various contributions to make. So what I would like to start off with, and maybe we could sort of start off maybe Chukwu from the Nigeria perspective, is, when we talk about investment in malaria elimination, when we talk about what are the needs for a country like Nigeria to move across towards elimination, what are the challenges you experience in securing sustainable financing for these interventions? Maybe we could start from the program side, and maybe Chukwu, if you would like to comment.
Okay, thank you very much, James, for that question. As you know, Nigeria is a big country. Actually, you call it 37 countries in one country. And the situation, when it comes about malaria, the malaria situation is heterogeneous and diverse. So you have a whole lot of scenario playing out, especially when it comes to prevalence, from high prevalence, especially in the Northeast and Northwest, to lower prevalences in the South, especially in Lagos, where we are almost at pre-elimination levels. But as you said, the key challenge here is trying to make sure that we implement at scale, and trying to get those resources is one of the biggest tasks that the program has faced. Yes, we have quite a number of donors supporting. We have the GF, the Global Funds, We have PMI, the USAID support, and then we have, of course, other supports coming in through philanthropic organizations like GiveWell. But that has not been sufficient. Even within the supported states, there are still huge gaps in terms of these things. For example, in our costed plan and the National Strategic Plan, currently we have 50% of that costed plan is not funded. So we have quite significant issues when it comes to funding, trying to implement at scale some of the interventions that are laid out in the National Strategic Plan. And yes, the challenge has been with some part of it, the state governments, getting the federal government to support these interventions, being able to mobilize the private sector to also support interventions, and a few other situations that making sure that they are also consistent even when they are supporting these particular interventions. And I can tell you, with the issues in the country, the economic outlook, issues that has to do with other things that compete for attention, it has been a huge challenge trying to get government and even the private sector to actually support the malaria elimination program activities.
Thank you, Chukwu. And I think you raised several points. And I think something that comes up is, one, the gap that you've described, 50% of your budget not being funded. And then I think what also is coming from what you're describing is the fact that funding is of several types and several sources. And I think that segues quite nicely into the role of philanthropic funding sources. And my question to Luke, in your role and the fact that philanthropic sources are really driven by an ethos around cost effectiveness. And I think you've heard what Chukwu has said, there's a budget, there's 50% gap. And how do you see the philanthropic community, participating in those dialogues or in those discussions such that the value that you bring can be optimized?
Yes, so there is a huge amount of philanthropic capital available that unfortunately goes largely untapped for some of the most effective interventions like the SMC program. So you see in countries like the UK and the US, the vast majority of philanthropic investment is domestic. And these are in some of the richest countries on earth, where it's pretty clear the biggest need is not necessarily in these places. And that when you have such a great evidence base for things like the SMC program, there is this big opportunity for impact and incredibly high cost effectiveness. Now, the challenge is getting donors to recognize that. A lot of people approach philanthropy from the perspective of something that they have personal experience with, something that they've seen personally. And in a country like the UK, where malaria isn't an issue, it's not something that comes to donors' minds. So we are seeing a shift in behavior, though, within the philanthropic sector, where people are starting to realize that they can make a lot more difference if they are able to seek out things that do have higher levels of impact and higher standards for what you can actually get for that philanthropic capital. And taking a step back and being a bit less parochial and focused on domestic issues, recognizing that we're all part of a much bigger world where there is very vastly different amounts of need and high levels of cost effectiveness in programs like SMC. So it is good to see that increased appetite. It's still a very small part of the philanthropic sector, and we're excited to see more donors taking that approach, but yeah, it has a very long way to go.
Thanks, Luke. And again, I think what's emerging is need and cost-effective programs, and the fact that you can achieve high impact when you bring those elements together. And Professor Sao, from the private sector perspective, how do you see again that relationship between gap, need, and the investments that are required to really make malaria history? And it's not something that can be done, just in 1 year or 2 years. It requires consistent funding that achieves high impact. So Professor Sao, from your perspective, how do you see the private sector playing a role? And are there any insights from some of the work that you're doing with MasterCard?
Thank you very much, James. Thank you for this invitation. And I'm very happy to be here on behalf of the MasterCard Foundation, the Department of Health. Just to maybe first to highlight some our vision as Mastercard Foundation working in the health sector in Africa. For us, the health is an economic sector, and we have decided to work at the primary health level, close to communities. And our priority number one is not going to university teaching hospitals, but how we can empower community health workers. Community health workers is our flagship program. And we would like, with other partners, to build a new model of community health workers that is integrated, that has a clear professional pathway, attracting young people in this area with certification, and then to be more attractive with digitalization of this for these community health workers, but not in a vertical approach, but in an integrated approach. For example, we are not working only on malaria, but all kind of disease at the community level to be more effective. Just to highlight again, the health department at the Mastercard Foundation, we have 3 pillars. Pillar number 1 is health employment, focusing on community health workers. Pillar number 2 is health ecosystem, and one mainly focusing on digitalization of data. It's so important because if you don't have good data, you cannot have good intervention. And the pillar number 3 is health entrepreneurship. How can we support entrepreneurs or young starters in the continent in the health sector? So these are our 3 pillars. And for malaria, for example, we are, supporting community health workers to be able, not only for malaria, as I said, but in an integrated approach. We are supporting also community health advocates at the community level because we believe everything happens at the community level. So if you have a good community advocates at this, for educating people, for sensitization people about all these kind of diseases, you might have a significant impact. For malaria, we have all the tools. We know that is working. Bet nets, rapid diagnostic tests. But what is lacking is to have a very strong community-based approach. And this is how we are working. And for your question, at the Mastercard Foundation, we love co-creation. We sit with countries, we sit with implementing partners to discuss and to find out where can we have our intervention. Very, science-based evidence, very focused, and together cooperation, co-shaping, we will have something that together we will implement. So this is how we are working. It's not only money, but it is also sitting with our partners, sitting with countries, and to define together where really the needs are and how we can impact these needs. As I said, also, we are focusing basically in young people in the continent to provide 30 million jobs in the continent from now to 2030. And this means community health workers, this means community advocate, this means also supporting young entrepreneurs in this, for example, for malaria, providing jobs for young entrepreneurs, local manufacturing, these rapid diagnostic techs, these bet nets, and this is an opportunity also to support the economy in our country. So in summary, health for us is an economic sector with the 3 pillars: employment, ecosystem, and entrepreneurship. And digitalization is so important today. We have so many young people in the continent. You have just to train them, to give them some support, and they will, provide good data. Without good data in our countries, it will be very difficult to measure our progress, to see our target. So thank you so much, James.
Thank you very much, Professor Sao. I think that segues quite nicely to the youth. And how do the youth engage? How do the youth advocate and really harness these various resources so that they can participate in the malaria elimination agenda?
That was the role that young people would have to play in making sure that the malaria agenda is pushed forward. And I think first it has to do with advocacy and also awareness creation. I believe that this whole issue has been around for ages and decades, but how well are young people advocating for malaria issues within their communities? How well are they advocating for resource, and also budgeting in their communities? I think these are the areas that we could also be looking at when it comes to their advocacy, and also innovation and technology. That's also another point. When it comes to that aspect, we can think about how young people can be encouraged to develop innovative solutions around these areas, because we are looking at resource mobilization, how we are leveraging on these resources. And I believe that if young people are being encouraged, or even if they find themselves within spaces where the opportunities, I believe that investing in innovation and technology to be able to come up with new technologies that can combat the malaria issues and even the parasite itself, I think that this can really go a very long way. And also when it comes to community engagement, I believe that young people do have a big role to play within their communities as well, in terms of how they even mobilize the community to do cleanup exercises, how they mobilize communities to, partake in even using treated bed nets. I think these are key priority issues that young people should focus on within their specific countries and communities, especially within sub-Saharan Africa, because we seem to really have the prevalence of, high death of, malaria seems to be within the sub-Saharan Africa. So I think this is what young people can do to ensure that, we're able to leverage on the resources that are available, because like Luke mentioned, the resources are quite there. So it's just about leveraging on these resources, being innovative enough, advocating, creating awareness, and engaging within our communities to combat the malaria issues. Thank you.
Thank you, Vivian. And you've again highlighted the role of innovation and technology. And I think Professor Sao really brought up the point around digitalization. So I just wanted to nicely segue and then come back to Luke and Chuku. So I think, Professor Sao, is there a chance that Africa, malaria endemic countries get left behind the information transformation because we don't have the systems for good data? We don't have the digital pathways that allow us to get quality data. And is this why MasterCard Foundation is really putting that as an important part of its work?
Yes, James. I think it was just the beginning of March with Africa CDC in Addis Ababa. It was the opportunity to launch they call it the Africa Digital Platform. And this applies for all diseases. As infectious disease physician and practicing for more than 30 years in the continent, I was very frustrated every time to receive my patient. Everything was paper-based. And when I have to receive my patient 3 months later, it was very difficult to find his medical dossier because it is paper-based. Sometimes I cannot find it, etc. So right now, the MasterCard Foundation is supporting a huge health system, digitalized health system for, to health system strengthening, and also patient having their own data in their smartphone, for example. So you can have the electronic medical data, you can have your lab result tests in your smartphone, you can have your prescription in your smartphone, you can have your vaccination electronic card in your smartphone. It's not only COVID, but yellow fever, all the things. So this, and we have the capacity. So we are supporting the talent development in the African continent. We are supporting also countries to have a very robust health surveillance system. Again, if you don't have the good data, good quality, you can't have, good decision. It is important to know what is happening in north of Nigeria, Ghana, Senegal, and see if it an outbreak of the number of malaria cases there, and then you can make some intervention. And now we have very good interventions that are working. And the innovation for me, for malaria, let's implement what is working very well. What is working very well, I agree with Vivian, is, how we can use young people. women and boys to implement bed nets at the community level, how to engage communities, for awareness about malaria. These are strong opportunities, and these are evidence-based. They are working. How to empower the health workforce, to use digital platform to be able to record, to be able to have the data and to analyze the data. It's important also to analyze the data and define some intervention. So this is really our priority. We are supporting countries for digitalization, and we call it this program the Health My Way program to be a Pan-African one, because for us, digitalization is something it's innovation, is important, is very cost effective for our countries. Thank you, James.
Thanks, Professor. And I think, Luke, you heard this concept, what works very well. That's where the innovation is. What works very well and getting that to scale. So I think, Luke, that must be sort of very well aligned with the sort of the cost effectiveness lens to which some of the philanthropic funding sort of emphasizes. Then where do you see scope for innovation and either existing tools being used slightly differently or new tools being brought on board? Luke, what would be your insights and, again, your perspectives on how that helps to move the malaria elimination agenda forward?
UK Health Radio, the station that makes you feel good. UK Health Radio, the station that makes you feel good.
Yeah, so I think there are two major funding pathways that we see as particularly promising. So one is scaling up things that work. So things like the SMC program that has a strong evidence base. We know that there is very good understanding of what it's going to cost to roll out in another region in another year, where you can really scale that up and you see the size of that funding gap. And the other approach is to look at, things like innovation. So what are the things that, whether they to receive that initial funding to really prove the case, to test whether it works and can scale and can be more cost effective, and ensure those things get funded to the point at which we can ascertain how well it's working. And does this have a chance at outperforming the stuff that we've already identified has a need to scale up? Because if there's a program that turns out to be much more effective, then you can start shifting resources towards that. But if you're trying something new and it doesn't meet the same bar, then you don't want to send too many resources there. So having that mix of investing in innovation while scaling up things that we have strong evidence to work is a kind of nice approach that we find it's good to have a bit of a balance.
Thanks, Luke. Chukwu, as we again know, is that these innovations have to create impact in the field. And I think what you're hearing is that some funding sources really are looking for scale or cost-effective, new things that can prove to be more cost-effective or as cost-effective. Or, as I think Professor Sao has highlighted, the fact that there are some interventions or some innovations that really will help us to get what we know works very well to greater impact. So Chukwu, with all this, how do you want to move forward? How do you see Nigeria moving forward and really making a dent on malaria?
Yeah, that's also the question that we are asking ourselves. How do we move forward? How do we make a greater impact on malaria prevalence and burden? We've done a whole lot of things. For example, our strategic plan is based on subnational tailoring, which means trying to target interventions by localities at the lowest administrative level based on what we know and what works best. But still, we are still trying to find out, are these succeeding? So One of the things we hope will be a game changer as we move on is this issue of the malaria vaccine. We hope that with this particular one coming out now, we already have the first one that WHO has approved, and then the current Oxford vaccine that also our country has also given initial approval. So we think that this also will be a game changer when we're talking about malaria in the country, because it's going to target the proportion of those at risk, greatest at risk, those that are less than 3 years. So again, one of the things that we are having challenges on, we know that networks. We know that when used consistently and correctly, ITNs work. But also we know that if we can be able to mobilize resources and deploy on a consistent basis IRS, we think, especially in targeted areas, we think we can crash the burden down in a lot of places. And we might even succeed in bringing most of these places to pre-elimination levels.
Thank you, Chukwu. Back to Professor Sao, because youth has come up in sort of the agenda around the MasterCard Foundation. And I just want to explore that point further in that, are we learning, or do we have the scope to learn from things that aren't working well, so that, as Dr. Chukwu has commented, that where we are facing those challenges, we are able to delve into the information, delve into the evidence, and learn from that? Could there be a possibility that we're heavily focused on what's working well?
I think for me, let me now take my, not from the MasterCard, but other physician who used to work in the continent, as I said, for more than 30 years. And as academic, at the morning, we are working at the university hospital, but believe me, and then during the afternoon, our focus was community-based approach. We going from the hospital to the community, the afternoons, and talking with communities. This was my best time to discuss with communities because, we use, for example, here in Senegal, we implemented so many malaria prevention interventions, focusing on youth and women. For, community ownership is so important for us. Community ownership is important for sensibilization, educating people. And I remember we implement health kiosk at the community level, villages, departments, so that people can and using our local language. So important. What is malaria? How it is transmitted? The symptoms and how the prevention activities. So, and people can go at any time at this health kiosk. We call it health kiosk. This is not district hospital, but people are not sick. They have to go something very close to their communities. And this health kiosk was really an opportunity for them to learn and to be able to know what is malaria, and most important, how to prevent malaria. As I said, we have wonderful intervention. We just need to implement what is working. Using bed nets, we educated these people how to use them. If you have fever, please go to your community health workers or the nurse at the district hospital, because we have now a wonderful innovation is the rapid test diagnostic. In 15 minutes, you can know, okay, this is fever, it is malaria. Or this is fever, it's not malaria. So we have all these fantastic things. And as infectious diseases, I used to receive before the rapid test diagnostic intervention, I used to send the sample to the lab. It takes 24 hours. So you don't know if it is malaria. And now it's time for complication. But right now I have this wonderful tool. In 15 minutes, I can say, yes, it is malaria. Please take the drug. No, it is not malaria. Maybe it is the viral diseases. So let's implement really what is working at the community level. And this expertise, this experience working with community in Senegal, this is a wonderful area. It's clean. You educate people why it is important to have a clean environment, why it is important to be involved, young people and women, and these are opportunities for job creation at the community level. So they have their income generating activities working on malaria or working on family planning. It's important for me to have this community ownership. They can understand, and we at the health sector to support them to implement all these things. So I think, James, what is really for me innovation is to have a very strong community-based approach for malaria and implement what is working.
Look, does cost effectiveness embrace context? I mean, when we look at the various models, is there an element of context that comes in that says we conscious that things may be more effective in one location compared to another location, and we're aware of that?
Yeah, absolutely. So, for example, when it comes to bed nets, you see insecticide resistance can be different in different regions. So, ideally, any program, you're able to break it down to its constituent parts and kind of have a cost effectiveness model for the kind of next part of the program rollout. Just when resources are so constrained, trying to pick all the low hanging fruit first is such an important priority. So, whether it's the particular intervention, insecticide treated bed nets or SMC or something else, and where it's being rolled out and what those particular contexts are. The other thing too is sometimes the cost of delivery. Some regions are much harder to get particular medicines and bed nets and things like that too as well. So these all have to come into account when you are trying to think, where does that next dollar go?
Let's talk about the role the youth have in influencing their leaders. And I think, Vivian, you started talking about that. What role do you have and what are some of the things you're doing to really maintain the malaria elimination agenda high up on the priority list of our leaders? And how can you continue to do that? How do you want to continue to be engaged? You've heard from Professor Sao about really the role the youth have to play. So how do you see yourselves and the organizations you sort of work with and you network with maintaining malaria elimination as a priority amongst our leaders?
That our agenda or our focus has been really putting priority on resource allocation. We realize that government has quite a lot of things on their budgets. Even when it comes to the health sector, there are a lot of things taking government priority. But then the question is, how do we put focus or how do we invest critically within the space? And that is where young people have been pushing more advocacy into. And also when it comes to effectively engaging these policymakers, our focus has also been in creating that space where young people can have that face-to-face engagement with policymakers. So we have the African Youth SDG Summit as an example of some of these conferences that provide that space for young people to engage with policymakers, because sometimes you find them within their offices or within conferences where you as a young person may not have that capacity or let me put it, how should I put it? You may not necessarily have that opportunity to be in that same space with them, but these platforms, these conferences and summits provides that or bridges that gap that exists between the policymakers and young people. And I think it's been quite great in all our efforts and in putting together the summit where young people are able to influence the decisions of policymakers. So I think this has been some of the key things that I would want to highlight.
Are there situations where you feel the youth are not either vocal enough or are not heard? Are there some scenarios that you feel we can do more to listen to the youth or do more to give space for the youth to be engaged?
Yeah, definitely. You realize that within the space, there's a good side and there's that limitation. So sometimes it even has to do with the capacity that even as you're engaging with these policymakers, do you have the capacity to hit on the right, to hammer the salient issues where you know that, okay, when I meet this policymaker, this is how I'm able to lobby out the specific issues. This is how I'm able to put together, project the malaria agenda to them. So there are also some capacity gaps where young people lack that capacity to really influence decisions in that aspect where they're actually lobbying for the right things to be done. So yes, the effort is being made, but then there's also that sort of capacity gap in implementing this whole efforts.
That is so important. In addition to the policy at the Mastercard Foundation, we really support the talent development for young people in the continent. This is an opportunity for the continent in terms of human capital development, talent development, using young people, involving young people, boys and girls in the health sector. And I said it's an opportunity for job creation for young people at all levels. Young people are very good on using new technologies. So this is an important also, and cell phone penetration in Africa is so high. This is a wonderful opportunity also. So using social media, building talent development for young people, using our local language is so important for promoting, marketing things that are working at the community level.
UK Health Radio, the station that makes you feel good. UK Health Radio, the station that makes you feel good.
I want to just get to this notion that I think for cost effectiveness models to really take root as decision making within the ecosystem, the youth and I think the leaders that we interact with need to understand what cost effectiveness means and how it fits into decision making. Luke, do you find that translating the work you do in philanthropy and the decision models that you utilize are easily understood by the youth, by the leaders that are engaged in malaria elimination? Is there more scope to improve that level of understanding and utility?
Yeah, on the donor side of things, it can be very complicated to understand a sophisticated model. And there's this trade-off between sophistication, we're doing a good job of doing things like accounting for the specific context that we were talking about before, versus is the model really easily understood, and are people aware of the judgments that are being made in what data is included and what considerations are included. I think at a top level, trying to nudge people away from thinking of quite simple metrics like how much of a program cost is spent on promoting the program or on overhead costs at various different times, versus getting them to focus on how much impact is the intervention having per dollar spent on it. Those kind of top level things are a lot easier to get people broad understanding of. And we do see that particularly young people who might be a little bit more disenfranchised with charity as a sector and philanthropy as a way of solving problems, just less likely to give and a bit less trusting of it. And I think that they may have been burnt in the past and kind of rightly so might be a bit distrusting, a bit skeptical. But when you have pretty strong data and pretty good models, helping them understand the basic underlying principle that you have these impacts in the world that you care about. You want to reduce the number of deaths. You want to improve the quality of life. You want to increase the access to these life-saving and life-improving interventions. And you have these outcomes in mind, and then you know how much does it cost to get us there. And you have excellent monitoring and evaluation along the way. I think it really helps build trust, and that trust can help increase the amount of funding that's available to these really important causes.
Chukwu, from programmatic perspective, we've talked about leadership, leaders, we've talked about the youth. How do you see that coming together, within the auspices of a national program to expand the opportunities for malaria elimination in the context where national leadership, national ownership is key?
Let me start by saying that let's look at several components, or if you like, the domain. You have the issue of the interventions themselves. How effective, how innovative are they, trying to make sure that you reduce the malaria burden in the country. The second aspect or component or domain is the process of delivery. How do you ensure that these interventions get to where they are supposed to get, in which particular area, locality, and all that? Is it at the community level or the school level and all that? Or the health facility level. So that also is another aspect of it. Then the other aspect of it is the issue of reporting and making sure that you have quality data that can enhance decision making, in a timely manner. So these are three dimensions that I think needs to be addressed comprehensively. And in this connection, at each moment or at each of these dimensions, you need people to rally around and make sure that things are being done the way they ought to be. And it is here that the government tries to provide the issues about leadership. In terms of ensuring quality, we're trying to look at quality of data. We're trying to go the way also that Prof has mentioned, We're trying to go the way of digitization and digitalization, and then also trying to see how we can improve community, engagement and community making sure the community part and parcel of what we are doing, and also monitoring what is being done. And then we're also trying to ensure that young people come in. One of the things that we are seeing in the African continent, well, I cannot speak for Nigeria, is that there is some level of increasing awareness among young people to be part and parcel of this, to eliminate malaria. But this is all something that we need, as a government, needs to coordinate. And we're trying to bring all this down, trying to strengthen coordination structures at various levels, trying to put up innovative ways of domestic resource mobilization. For example, the issue of the Nigerian and Malaria Council, which we try to put on, and then trying to coordinate all other aspects to make sure that right interventions are being delivered and that more are being brought on board, given the resources that are available. But I can tell you that in the midst of all this, the challenges seem to be overwhelming. But again, partnership is key. And we're trying to make sure that partners, Nigerian engages all partners that are relevant and mobilize more partners to be part and parcel of this process. I hope I'll be able to address the issue.
Yes, and you brought in the concept of partnerships, and maybe based on what you've heard today from the various viewpoints, philanthropy, private sector, the job creation, malaria fitting into an economic agenda, the role of the youth, and I think you've pointed out partnerships being key. Do you see these partnerships coming together in a manner that fosters national ownership? And are there areas that you feel require more attention going forward?
Yeah, that's been one of the things that we do, and maybe also one of our strong points. We try to ensure that we have the platforms that encourages partnership in the country at the various levels, at the national and at the subnational level. One of the things we also know is that there is a lot of, some partners are also trying to do what they want to do at the subnational level without a cost to the national and without a cost to the national guidelines. Now, that's one of the areas where we think there needs to be a greater coordination of what is happening at the subnational level to ensure that people are all aligned to what we are doing at the national level and to the coordination structures that we have put forward. There is still a lot of opportunity. And then one of also the areas that we are also trying to make sure is it does not happen is making sure there's duplication of effort. We see quite a number of partners going into particular area, maybe because of the funding that's available, maybe because of the interest being shown there, and then a few other areas not being neglected. We also want to make sure that this is an area we want to streamline to ensure that people are invited to the new areas where we have need and where we think can make impact, where we think there could be room for innovation, and where we think we could be able to make more impact on the malaria body in the country, so that we do not all have all the partners being in the same spot or almost around the same spot, maybe in the different localities, and then doing the same thing all over and over again. And yet we're coming down and we're having the same level of prevalence that we're having 5 years, 10 years ago, and nothing much is changing, even when there is a decrease.
Just to add something using my previous life,
yes,
and
Professor
I had the
Sao.
opportunity and the privilege working with the Minister of Health as, infectious disease expert. And I totally agree with Chuku. Country ownership is so important. And also the partnership to avoid duplication. It is a complementarity. What we used to do is to sit on the round table and mapping the needs and the priority with the different, funders, the private sector, philanthropic, even the domestic opportunities. We have domestic businesses very strong. They would like. So we sit together and we make a mapping exercise, the priority in terms of, for example, malaria elimination. The funders have to come and sit together and work with the Ministry of Health, work with the national program, because they know what is happening. Know your epidemic, know your response. I think partnership for me is so important. And this is also what we are doing at the MasterCard Foundation. And I've said it again, is co-creation, co-shaping together and co-implementing. This will avoid duplication, transparency, respecting each other, humility. All these values are so important, not only for malaria, but if we would like to improve universal health access program in Africa.
So just like they've mentioned country ownership, I think what I would like to bring into play is also community ownership, that we should forge partnership with community leaders. We shouldn't just make them the receivers of our interventions, but then we should make them key partners in everything that we do. This goes a long way in promoting the sustainability of whatever intervention that we do within such communities. I've personally witnessed communities undertake community cleanup exercises on their own after the people who came, like after the organization that led the whole process left. So you realize that when you make these community leaders, the chiefs, the opinion leaders, when you engage them critically and make them own the initiative, they pick it up after you leave. And this goes a long way in sustaining the whole process and the whole intervention that has been made within that community.
So as we wrap up, what would make a difference from your perspective to move us closer to malaria elimination? Vivian, would you like to start off?
So for me, I think what would make the big difference is that it will focus much more on innovation, technology and innovation. I felt a bit threatened when I heard that we have a new breed of mosquito within my country. And I was just wondering, okay, so how did they detect this new breed? And it's just all about innovation. What are the innovative ways? What are the various technologies that are available to us? And how are we leveraging on them? So for me, I think the big leap to achieving this goal is to prioritize on innovation and technology. And of course, that would also come into play if there's enough funding for, there's enough government budgetary allocation for this whole process. So yeah, those two things I think would be a great leap, and that is what I'm looking forward to.
Thanks, Vivian. Luke?
Yeah, for me, I think that the available funding is something that we obviously care about. And people listening in, I think this is being broadcast in the UK, among some of the richest people in the world. And while I think it's been a tough year for many people financially, thinking about the impact that you can have on others and making sure that money is able to go as far as it can to help those who need it most, to scale up these interventions that have such strong evidence that they work really well and really effectively, and to be able to find that innovation that can help us to meet the next need and find those next scalable interventions. So for those, especially in the UK, who would be hearing this, just the opportunity to fund solutions to one of the world's biggest problems that we face, that is affecting a huge number of lives, and that we can make such a huge difference to a relatively small amount of money compared to the resources that people in the UK have available to them. So if we can fund this amazing work that the people here today are doing, that would just be fantastic.
Professor Sao?
Thank you, James. For me, malaria elimination is basically really, let's amplify, let's go for scaling up interventions that are really working at community level. I strongly believe on community ownership, on community engagement, country ownership. I think these are the key. Let's really implement this activity. The second is using new technologies for prevention, for educated people. So to educate people at the community level. I think this is important. It's a wonderful opportunity. Learn from COVID. You can use social media to educate people what is malaria, why it is important for prevention. The last one is partnership. All funders, we need to sit together and work with countries, work with communities, work with NGOs, and define together a national program to implement its complementarity and avoid duplication.
Thank you very much, Professor Sao. Chukwu, if we don't eliminate malaria in Nigeria, we can't eliminate it for the world. What should we do?
Yeah. Yes, indeed, James. If you do not address the problem of malaria in Nigeria, they have a third of all the malaria deaths in the whole world, a quarter of cases also in the whole world. So anyone that overlooks Nigeria does so is on detriment. For me, there are two critical areas, but with some breakdown. First is the issue of resource. And here I'm looking at supporting countries, and in this context, Nigeria, to be able to mobilize domestic resources, improve on domestic resource mobilization. So, and for sustainability, that's always the way to go. Make sure that most of the resources that you need for the program comes from internally from sustainable sources within the country, not simply relying on external donors. Two is innovation, but innovation in various ways. Innovation in terms of what we are currently doing. I use the word ACTs. Now we are having signals in terms of resistance to ACTs, and we need to start thinking about what do we need. How do we go a little bit further to see what can be done in case our normal ACTs fail finally. And then, of course, I know that there's ongoing operational research and trying to see what can be done and to fortify that aspect. So we also need to see innovations in terms of the interventions that could work. We don't want to start doing new things, but we also want to have new things that will have a huge impact on the malaria burden. And then, of course, we also want to see innovations in terms of reporting, in terms of improving data quality, because the quality of data also determines to what extent you can utilize or rely on your data to make appropriate decisions in order to move forward. And it is that data that will tell you whether you are going on the right way or whether you are approaching pre-elimination or whether you are still around the same cycle that you've been operating in the last 4 or 5 years. So it is in this context that I would say these are the two, for me, critical areas that needs to happen before we can make any meaningful headway. Over to you, James, and thank you very much.
Thank you very much, Chuku. And on that note, I would like to thank all the panelists for this very interesting conversation around malaria elimination and some of the things that we can do and some of the experiences that we have. Thank you for your commitment, your dedication, and we all aspire to eliminate malaria in our generation, and collectively we can do so. Thank you very much.